Alors aujourd'hui, Christian, tu as dû entendre que beaucoup de cancers.
Today, we hear more and more that cancer is genetic. How do you approach this concept?
Alors, non seulement les cancers, mais il y a beaucoup de théories
It's not only about cancer. We hear about theories talking about the genetic origin of heart disease, the genetic origin of stomach issues like ulcers, or about other conditions that we may find in several members of a family. In one family, we may find 2 people affected with psoriasis or 3 people with melanoma. So we have this theory, and we have also other theories based on the infectious origin of cancer or stomach ulcer. So we have those theories. I have 5 fingers, therefore it's genetic. I got them at birth, not when I turned 40. The color of my eyes is genetic, as well as the shape of my ears, etc. So, what is genetic and active appears at conception and will be seen in full at birth and will last for life. I'm a man, it's genetic. Genetically, it won't change. So, why would a healthy organ such as the heart, the lung, the breast change? It's as if I had a 6th finger growing, but it's genetic. Since the age of 46, I have a 6th finger, or my eyes turned green, or one turned yellow and the other blue. No. So there's an active genetics and a passive genetics. What does it mean? Scientists realized that it's not only the gene that is transmitted, but also a switch, on and off. It means that we could carry a genetic disease which will never manifest because it will remain off throughout life. So we may carry the gene of lung cancer, for instance, but will never develop lung cancer. It will be off all the time. And then, in some people who carry this gene, it will switch on at 30, 38, 60 years old, and from there, they develop a genetic disease. First, what I'm interested in is what makes it switch on. That's what I'm interested in. Why is it at 32 years old and not at 31 or 33? What is happening at this time? And this is where biodecoding will talk about triggering conflicts, the bioshock, the event, which will stimulate a solution of adaptation and survival. For instance, I experience getting laid off and I devalue myself. Self-devaluation impacts the bones, so there will be bone issues. I lose my job and it was my territory. The loss of territory impacts the coronary arteries, so I do angina pectoris and will find the responsible gene which has simply switched on at this specific time. So whether there's a gene or not doesn't change anything. What's important is what happens at this specific age, and there we find the triggering conflict. So a lot of things can be transmitted and not be used, as well as we can do the same disease as our father or grandfather and not carry the gene. Unless we found the genes responsible for hay fever or fungal nail infection, but in my knowledge it hasn't been found yet. Maybe one day we'll find the gene that makes people give a genetic interpretation to all things. So, if it happens that you carry this gene, you may search for the genetic purpose in everything. I don't have this gene, I have another one, the one of biodecoding, so I talk about biodecoding. More seriously, as I was explaining in a previous video, our life, our programs of adaptation start before our conception. So, in this space-time prior to conception, dramas and challenges occur to which we must adapt.
auquel il faut s'adapter. Les parents mangent
The parents eat sour grapes, and the children's teeth are set on edge. It's a quote from one of the Gospels, but I forgot which one.
mais c'est une métaphore.
It's a metaphor which says that the parents carry the problem, and it's the children who develop the reaction.
Donc,
So once again, if I deal with genetic cancer, I look for the triggering conflict, then the programming conflict,
le déclencheur,
and sometimes the programming is within the ancestors. So whether it's genetic or not, biodecoding approaches disease the same way. Yes, absolutely.
Merci Marianne.
Thank you, Christian. Thank you.